Okay, so to you, what is evidence-based practice?
Basically, evidence-based practice is research and the evidence found from research, along with like a clinician's knowledge and expertise, combined to basically make the best decision possible, and for the best outcome for whatever patient population you're working with.
Mm-hmm. So how do you utilize evidence-based practice in your athletic training room?
I don't very often, to be honest. Probably the most common time that I would use it is if I'm unsure of like an eval or a diagnosis, or I can't come up with some sort of treatment or plan of action for an athlete. So then I would go to the research and try to find something. But I try to keep up to date with like articles and things that come out, and new research that comes out. So at least, I'm up to date and current with that stuff. But I don't typically, for the most part, go and find research and try to update everything all the time. It's kind of just whenever I need to use it.
Mm-hmm. Do you feel like you're prepared to practice evidence-based?
Somewhat. I had a couple of years of experience in school with it. Some of our professors taught it more than others. So I have a little bit of knowledge from school. Definitely with my master's, they focused on that a lot. But I think I could be more prepared. And I know I just started doing some of the CEUs for evidence-based practice, and it's kind of a good review. But they're also really basic knowledge, and so I probably could be a lot more prepared.
So what point did you start hearing about the push for EBP?
I would say probably 2 or 3 years ago, when I started school in 2009. There was nothing about it, at least not at the school I attended. So toward the end of getting my bachelor's degrees, I feel like they started pushing it. So I'd say probably 3 years ago.
So what do you think the benefits of using EBP in the practice are?
Probably the most beneficial thing would just be to benefit our patients and to better the quality of our care for our patients, and keep us as athletic trainers up to date and keep learning and growing, and keep current with the most current methods that other medical professionals are using.
Do you think there are any challenges in your past experience as to why you may not be able to practice EBP?
Probably just the lack of knowledge, especially because it's such a recent integration into our profession that there's just not, we haven't really been trained enough, I don't think, to do everything correctly. We may be able to do some research, but to go through all of those steps of appraising and then applying, probably we just aren't taught well enough. And then also just that it's really time consuming. It's not something you can do on your lunch break for 15 minutes. You have to sit down and really take a lot of time to go through the research and make sure it's valid and reliable, and then to have to apply it and then make sure that it's working after the fact. So
do you see any of your colleagues using EBP more so or less so than you do?
Not as much athletic training, especially in the high school setting. Definitely the physical therapists that I work with use it a little bit more often. I feel like they always have new articles out and are trying to come up with new treatments for patients and stuff like that, but not so much athletic training. No.
All right. Anything else that you want to add?
I don't think so.
Okay.